All right, welcome back, everyone. So we're going to continue here, and this will be our last part for kind of this section, and then we'll move on to some new material. But in this last part here, what we're going to look at is look at our electrocardiogram, right? So you may have heard of an electrocardiogram. It is often abbreviated EKG or ECG, kind of depending on what text or what source you're using. The difference in the lettering, so EKG or ECG, is a reflection of the fact that in English, cardio, referring to heart, is with a C, and in German it is with a K. So you may say ECG or EKG, but they're both referring to the same thing, right? So what this is this is it's a clinical tool that's used to visualize the electrical activity of the heart. So we're detecting the electrical signals of the cardiac muscle cells, and again, this can be used to identify various heart abnormalities, or different heart abnormalities can be reflected in an EKG. So abnormal heart rhythms, heart attacks. So myocardial infarctions may sometimes also show up on a EKG reading, right? So what we're going to look at is we're going to look at some basic waveforms, excuse me, some basic waveforms, so some basic parts of an EKG, and then we'll look at some more detailed components, and then we'll actually look at some images as well, right? So these three here, so the P wave, QRS complex, and T wave, these are the three kind of primary waveforms that you see on an EKG, right? So this first one, the P wave, right? So the P wave is corresponding to atrial depolarization, right? So atria are top chambers, and then depolarization. This is essentially think of this as contraction, right? So for all intents and purposes, you can think of the depolarization of the muscle of the heart is the contraction. So this is our atria contracting, right? So if you think about where the electrical activity starts, where it originates in the heart, right? We know that this corresponds, or this is starting in the SA node, right? So this P wave is corresponding to that initial activity in the SA node, starting that electrical activity, and then going through the atria and causing the atria to contract, right? The second major form that you'll see is called the QRS complex, right? So the QRS complex, this is representing ventricular depolarization, right? So now we're in the bottom ventricles, okay, the bottom chambers, which are our ventricles, and this is the contraction of those ventricles, right? So this is logically going to follow after our P wave, excuse me, after our atrial depolarization, right? So our atria contract, blood is moving down into our ventricles, and then you have your QRS complex, you have your ventricles contract. Remember that along the way, so along the path that the electrical activity is taking, remember it's delayed before it reaches the ventricles, right? So we have a period in between the P wave and QRS complex when that electrical signal stops briefly, right? So for something like a tenth of a second, and then continues into the ventricles and causes the ventricles to contract, right? Remember, those Purkinje fibers kind of permeate the ventricular myocardium, right? And then our third major waveform that we see is called the T wave, right? So P, QRS, and then our T wave. This is representing ventricular repolarization, right? And for repolarization, essentially think relaxation, right? So now we had our atria contract, we have our ventricles contract, and then we have our ventricles relax, right? Now you'll notice here that we have, so atrial depolarization, ventricular depolarization, ventricular repolarization. Which one are we missing, right? We're missing atrial repolarization, right? So where is it? Where does it occur? Does it occur, right? Well, of course it occurs. We have our atria contract. The atria are then going to relax. However, the atrial repolarization, that activity, is not reflected as a waveform because it's essentially being covered up by the magnitude of the QRS complex, right? So they're essentially happening at a similar time, but the electrical activity produced by the ventricles contracting essentially kind of overshadows and covers up the electrical activity of the atria relaxing, right? So atrial repolarization occurs, but you don't see it on an EKG, right? So if we look here to the right, this is our pattern. So here's our P wave, here's our QRS complex, here's a T wave. You also have things called segments, and you also have ones called intervals, right? So a segment is a period or a stretch of electrical activity in between two waves, right? So in between the P and the Q wave, in between the S and the T wave. So we call these segments, right? And these segments, if you look at them on this right image here, they're flat, right? They're these flat regions. And that's corresponding to the plateau phase of the action potential, right? So remember, this EKG, this is not the action potential, okay? This is a measure, a visualization of the sum of the electrical activity coming from the heart, right? So it's not the action potential. The action potential was what we looked at in one of the previous parts, right? So these segments here, the PQ segment and the ST segment, this is corresponding to the plateau phase of those cardiac action potentials, right? So remember, the plateau phase, this is when you have kind of that sustained contraction, right? And again, that cardiac action potential, that's occurring for both the atria and the ventricles, right? So you're having this activity occur in the atrial area and the ventricular area, right? So you'll have two of these segments. You get the PQ, this is corresponding to the atrial cells plateau phase, so the point in which the atria are contracting. And then you have the same thing for the ST segment, but in this case it's for the ventricles contracting, right? And then for both of those, it would be followed by relaxation, right? So the straight line that you see on an EKG, that's corresponding to no change in electrical activity, right? There's no changes in electrical activity in one way or the other, right? Now you also have what are called intervals, and intervals are incorporating a wave and then maybe also a segment as well, or part of a segment, right? So you can have your PR interval, and I apologize for this being cut off, this just says ventricular. So in this case, the PR, so we have it from the start of the P wave to the beginning of the Q wave, so before we get to the R, so this is, but it's referred to as the PR interval. And so if you think about what these waveforms are representing, then you can think about what these intervals and segments correspond to, right? In this case, these intervals. So PR, so we know the P wave is atrial contraction, right? Atrial depolarization, right? So PR interval is this, so again, up to the QRS complex, this is the time that it takes for the atria to begin contracting, and it spreads through the atrium right up until we begin ventricular contraction, right, or ventricular depolarization, right? So from atrial depolarization to the very beginning of ventricular depolarization. So atrial contraction to the start of ventricle contraction, right? The QT interval, this is essentially describing the activity going on in just the ventricles, right? So QRS, we know that QRS is ventricular contraction, right? And then we know that T wave is ventricular relaxation. So ventricular depolarization followed by ventricular repolarization, right? So this is the time that it takes the action potentials to flow through the ventricles, causing them to contract. There's a sustained contraction, right, with part of the plateau phase, so this ST segment, and then you have the ventricles relaxing, right? So depending on how fast the heart rate is occurring, then these different segments and intervals may be shorter or in some cases may be longer, right? So in this case, QT interval, sometimes you can have a prolonged QT interval, and it's referred to as just a prolonged QT interval. And this increases your risk as it lengthens. It increases individuals' risk of potential arrhythmias, right? And sometimes life-threatening arrhythmias as well, right? So here's just a more zoomed in image of the exact same thing. And again, you see your P, QRS, and T. And then you see two segments, PQ segment, ST segment, and then you also see your PR interval and your QT interval as well, right? So for each of these, one thing I would recommend you do to learn this is to practice drawing a normal EKG waveform. So draw the P, draw the QRS, draw the T, and then go in and label it, right? So label the P, QRS, T, label the segments, label the intervals, and then think about what's happening at each of those, right? So don't just label it P, QRS, and T, but then say, okay, here's the P, what's happening at the P wave? Here's the QRS, what's happening? Here's the T wave, here's what's happening, and so on, right? So one thing I want to highlight here is show you a EKG waveform here, and then lay over it the corresponding cardiac action potential and where they kind of line up, right? So here what you see is you see the normal EKG here in black. So you can see P wave, you can see Q, R, S, and then you can see a T wave, right? So in blue, what we have two graphs. They're not labeled, but we have two graphs of a cardiac action potential, right? So this would look similar to one of our previous lectures that we looked at, one of our previous parts of this video, looking at the cardiac action potential, right? So we have our depolarization phase, we have our plateau phase, and we have repolarization, the same thing with this larger one, right? So the smaller blue waveform, this is reflecting the changes in the atria, right? Because this is associated with our P wave and that PR interval, right? Or that PQ segment. And then we have this larger one. This is reflecting the electrical activity in the ventricles, right? So associated with the QRS and with the T wave, right? And so what you'll see is that during these segments, right? So the PQ segment here, right? So P wave, Q, PQ segment. Most of this flat, no change in electrical activity, right? This corresponds to this flat plateau phase, right? So this is depolarization. Here's slight repolarization followed by plateau, and then here's repolarization, right? So most of this segment here, this PQ segment, corresponds and aligns with this plateau phase, right? So again, no electrical activity. This is the point in which the ventricles are still contracting. And then remember this repolarization, that corresponds to relaxation. And we said that atrial repolarization or relaxation is occurring at about the same time the ventricles begin to contract, right? And so you see that this is starting at about this time this large QRS complex is also starting as well, right? If we come over here to this larger blue one, we see the same thing. So we see this depolarization coming up here, and again, this is corresponding to the QRS complex. We have this ST segment, right? So here's our S, here's our T, here's our ST segment, and then here's our long plateau phase for our ventricles, and you'll see that it aligns nicely. And then whenever we begin to have ventricular repolarization, that's about the time we see our T wave, right? So you can see that it corresponds nicely whenever you overlay the cardiac action potential when you lay that over the normal EKG, right? Okay, so this is just a summary slide of all the things that are taking place in our EKG. So again, things happening in the atria, depolarization, the plateau phase, repolarization, and then the same thing in the ventricles, depolarization, plateau, and repolarization. So we can summarize this slide by looking at something like this, right? So 3 phases for the atrial activity, 3 phases for the ventricular activity, right? So depolarization, plateau, and repolarization for each of those. And remember that for atrial repolarization, this is not seen on the EKG, because remember it's happening at about the time you have your QRS complex. So it's just being overshadowed, essentially, is how you can think of that, right? So one thing to discuss in relation to the EKG are what are called arrhythmias, right? So you may see these called arrhythmias, dysrhythmias. Essentially what it is, it's an abnormal EKG. It's an abnormal electrical activity in the heart, and then this is reflected by changes in the EKG, right? So when you look at an EKG strip, you can see noticeable changes in P, QRS, and T, and also some of the intervals in those segments as well, right? So these are 3 common, what are referred to as heart blocks. And so a heart block is essentially something has caused a delay or something that's called impaired conduction of the electrical signal through the heart, resulting in inefficient electrical activity, which then leads to potential complications related to blood flow, so lightheadedness, fainting, irregular heartbeat, chest palpitations, things like this, right? Some of these are more severe than than others. Some of these are more noticeable than others as well. So if we look here, so we have what's called a first degree, second degree, third degree. I just want to show you a picture of some of these that I pulled. So for a first degree, the main thing that you have is you have a prolonging of the space in between the P wave and the QRS complex. So that space is getting slightly longer, right? Second degree, you will have progressively longer intervals between the P and the QRS, so this kind of PR interval or this PQ segment here, right? It'll get progressively longer. So here it's a certain length, it's a little bit longer, and then you drop a beat. So meaning you don't have the QRS complex show up for one of the heart beats, right? So for the associated with the P wave, you're missing a QRS essentially, right? You have something similar with what's called this type 2. So this is called Mobitz type 1. Sometimes it's also called a Winky-Bach. Mobitz type 2, very similar. It's also a second degree. In this case, the distance between the P and the QRS stays the same, but then you drop, right? And then for the third degree, you have essentially the atria and the ventricles are not in unison. So the P waves are essentially happening at a regular interval. The QRSs are happening at some interval themselves, but the P and the QRS are not interacting with each other. They're disorganized, in other words, right? So the atria are contracting on their own, and the ventricles are contracting on their own, and there's no synchrony, there's no compatibility between those two, right? So first degree, second degree, and third degree as well, right? And then a few abnormal, we'll just hit on these few here. A few abnormal heart rhythms. There are several, there are lots of different ones, but two in particular are what are called AFib and VFib, and you may have heard of these, right? So atrial fibrillation and ventricular fibrillation. So when you think of fibrillation, essentially think of fibrillation as like almost like quivering of the chamber, right? So quivering of the atria, quivering of the ventricle due to some abnormal flow of electrical activity, right? Whatever that may be caused by, right? So with atrial fibrillation, what you'll see is and I'll show you an image here, you'll see irregular activity where you would expect to see P waves, but then you'll still see QRS complexes, right? You'll still see QRS complexes, but you'll see no discernible P waves, right? Because in this case, it's the atria that are acting abnormal, right? For VFib, for ventricular fibrillation, you really won't see anything, right? So it's chaotic electrical activity in the ventricles. It's uncoordinated. This is not a life-sustaining electrical activity. Okay, so this is potentially fatal if not corrected. AFib, you can live with AFib. Individuals with AFib are they're at an increased risk for cardiovascular events, so things like stroke because of this kind of quivering of the atria. They're at an increased risk for forming clots. But VFib is very dangerous, right? So this requires defibrillation, right, with the AED, right? So if you look here, you can see these two, excuse me, you can see these two waveforms. So at the top, atrial fibrillation, you see QRS complexes, but there's no discernible P wave, and there's actually better images that I probably should have grabbed that show. It shows a little more chaos in the atria. And then for VFib, you notice that you don't see any discernible waveforms at all. You don't see a nice P, you don't see QRS, you don't see T, anything like that, right? So this is very common. Ventricular fibrillation essentially looks like just scribbling on the EKG strip, right? There's nothing discernible about it, right? So consider some of these questions. That is where we will leave off for this kind of part 2. And then when we will start some new content and looking at things related to something called the cardiac cycle. We will start that in a later part.